everyone. We're at the Rural Health Conference and I'd like to introduce...
I'm Renee Blackman. I'm the CEO at Gidgee Healing. Gidgee Healing is the Aboriginal medical service that services Mount Isa and the Gulf regions in northwest Queensland.
And what are you taking away from this Rural Health Conference?
Look, first and foremost, I guess it's great to catch up with colleagues that are working in the same space as us, but there's, for ACHOs or for Aboriginal Community Controlled Health Organisations, there's some key messages at the Rural Health Conference I think that have been very valuable for me to be a part of and actually listen to and talk with also people who are presenting on those topics. So one of the first ones, I guess, and I'll launch straight in, being an ACHO that actually delivers service in rural and remote Australia, or rural and remote North Queensland, northwest Queensland, I think it's really important for us as service providers to be in that space. We've got Aboriginal communities that are, I guess, situated up in the Gulf and in the northwest of Queensland. That's Mornington Island and Gidgee. And we really, really value the opportunity to actually deliver an ACHO model or a comprehensive care model of primary health care across those particular communities. And we are being well received. Our communities like us being there. It actually is the first time we've ventured into those communities. Our service delivery has only ever been, I guess, Mount Isa before. But it's new for those communities. And from coming to the Rural Health Conference, I think there has been a call here for a lot of the other the traditional service providers, say RFDS, some of those remote health service providers that have had a brief of going out to those communities, working with ACHOs. We've been able to do that now in the last 12 months to 2 years, and it's been a fantastic journey for all of us, I think. But having that Indigenous flavour from an ACHO is one of the main reasons why we're out there. Sorry, we've got Peanut Gallery behind me. It's all good.
Okay, so we want to have more rural communities, remote communities having access to ACHO
models, yes.
And we're talking, you have another very strong call to action out of this conference, which is relating to the deficit model that we hear so often. Can you explain about that?
Yeah, absolutely. So this is my first Rural Health Conference. Fantastically put together. Really love all of the, I guess, the subject matter that's being exchanged and the knowledges that are being exchanged here. One of the things I think that we always hear, and me as an Aboriginal woman as well, we do hear a lot of the deficit talk around what's so wrong with Aboriginal health. And I always have a common catch cry, and anyone that's heard me speak before, I always say I do not ever wake up in the morning and think, oh, what am I going to die of today? And I don't think any of our communities do either, and anyone that's living in our communities do. So one of the challenges I'd like to put out there to any conference that's covering Aboriginal health is you absolutely talk through some of the statistics that make it so, that justify the reasoning behind a particular service delivery, but don't dwell on that, because it's not about that for us. For us, it's about what are we doing? What are we doing? What are the good things that are coming out? And let's look at our people in a positive light, because we aren't broken. Our mob are not broken. We survive. We have survived now for 200 plus years, and we will continue to survive. So let's focus on it. Let's flip the conversation a little bit, I think.
And that segues into something else that you've been talking about, which is the benefits of privileging First Nation voices. We've talked about in primary health care, if you could explain that, and also in responding to issues like climate change.
Yeah,
so could you elaborate on those?
So one of the other things that's come out of the conference is a huge discussion piece on the social determinants of health and actually practising from that type of model, that philosophy, I guess. So putting the social determinants of health as part of the central point of how you deliver care rather than a medical model. Now, ACHOs, or Aboriginal Community Controlled Health Services, we've been doing that for the last 45 years plus. That's Indigenous knowledges, that's First Nations knowledges. Now, we've had the experience over that years of perfecting those sorts of models and that type of delivery of care that isn't just about, I guess, a medical model of getting someone, here's the sick person, let's give them this medication, let's get them better, let's put them back out on the battlefield. We worry about, obviously, the health and well-being, like physical health, but it's also about social emotional well-being. It's also about all of those things that make your world go round as a human being, bundling that up into whatever type of care that is. Now, that's from a justice perspective. There's lots of things bundled up in that, which is a social determinants way of thinking. Now, that sort of knowledge and then providing that type of care to some of the most underprivileged communities in Australia that's our expertise, and we've been doing that for the last 45 plus years. I'm sure that we can share and knowledge exchange a little bit better with our mainstream counterparts, because now we're seeing disparities in socioeconomics across the whole of Australia, not just Aboriginal people and non-Aboriginal people, but it's across the whole of Australia, and how we're going to deliver services to be able to, I guess, hit the nail on the head for everybody. Well, we've got the answers. I think it's time that we all started talking properly, talking genuinely, and valuing and privileging that knowledge and saying, well, that's where it's come from. It's happened a little bit at the conference. It would be good to see it a little bit more.
And how does that also tie in with responding to climate change?
Goodness. Well, there's a lot of inequities around climate change, I think, and you can only participate in climate change and climate change discussions if you're privileged in the first place to actually be at the table to have the conversation. And that's probably where we should be starting. And there is a lot of knowledge, Indigenous knowledges, about exactly how to protect our environment and actually contribute to better outcomes for climate change. Just have to ask the question.
Anything else you would like to add before we wrap up?
No, look, if anyone's thinking about the Rural Health Conference in the next 2 years, every 2 years, absolutely come along. I think it's a great conference, one to reconnect with colleagues, but also to understand some of the real challenges we have west of the Great Divide in Queensland for us, but also in rural and remote Australia. It's been a great experience. Thank you.